Hello, hello, everyone. I bring you tonight a very short overview and quick review of blood transfusion. So let's get started. Blood transfusion. Well, you're going to be giving blood transfusion for possibly patients that have blood disorders, or maybe they just had surgery. There's different reasons why someone could have a blood transfusion. So it's important for nursing to understand it. We do have different types of blood. They have RH factors that determine the compatibility and all this other stuff that we don't really need to get into depth right now. But there's an RH factor, and then there's different types. Everyone has a blood type. If you don't know your blood type, you can find out by donating blood. They'll tell you because they have to um, basically test your blood, okay? So some other important things that to know is that different blood types can receive or donate to other ones, but the universal donor is type O, negative. And the universal recipient that can receive from anyone, it's AB positive, okay? But here's a little chart so you can kind of tell like, okay, well, I am A positive, I can give to, and I can receive from, all right? So if you don't know what your blood type is, I encourage you to look it up, find it, go donate blood and see what it is. Now, blood is composed of different types of cells, okay? So we have not only red blood cells, we have platelets, we have fresh frozen plasma, and albumin. So quickly, I'm just gonna review here a little bit of this information. Red blood cells are the most common type of cell that is transfused. There's a less danger fluid overload, less risk of people being allergic to it. It's very commonly used for anemia and blood loss. And a pack of red blood cells or a little bag usually has about 250 to 300 and something mLs of blood. Um, the conversion, they say that for one pack of red blood cells, your patient should increase in their hemoglobin by 1 point. That's just an estimated that we say that in the hospital. Now, platelets, they're prepared from fresh whole blood. They're used for bleeding or thrombocytopenia when your platelets are low. And usually you see an increase of 5,000 per unit. Fresh frozen plasma, it's that liquid part of the blood. It's rich in coagulation factors, not platelets. So that's the difference between platelets and fresh frozen plasma. Fresh frozen plasma does not have platelets, it's just coagulation factors. And therefore, it is very good for treating causes that have problems with clotting factors or maybe vitamin K deficiency, hemorrhage, and whatnot. Because it is frozen, it needs to be thawed out. So that's another important thing. And last, it's albumin. Albumin, it's in the plasma and pretty much can be given to increase vascular system. It could be given to bring fluid from the third spacing to the intravascular system. So we use it for different things. All right, so what is the process for administering blood? Well, in class, I'm gonna be talking to you in more details of this, But for here, it's just an overview, okay? So yes, you need a physician orders. You need to have a blood type and blood cross match. Okay, you need to have a consent from the patient. You need to make sure that your patient has a good IV, a functional IV, in the appropriate size. In the hospital, we prefer 18 or 20. However, it can be given in 22, and the book talks about 22. But it's not the preferred gauge. And the reason for that is, we want it big enough where we can just transfuse at a good rate and that the cell can pass through the catheter. You do need a special tubing for blood. It has a filter. You only infuse it with normal saline, nothing else. You have to pick it up in blood bank. You have to administer the blood within 40, not 40, sorry, 4 hours from when you started and before 30 minutes after you receive it from blood bank. So for example, if I just get this bag and suddenly my IV just goes bad and I cannot infuse this through my IV, I need to return it. I need to call immediately blood bank and I need to return it to blood bank to be refrigerated again or follow their procedure. It's not like I can leave it on the counter and wait for pick team or wait another hour until I get an IV. No. And then it needs to be infused within 4 hours from the start time. It's double checked by 2 RNs. You check their patient's identifiers and sign off. You take vital signs very often before you start transfusion for the first 15 minutes and at 15 minutes. And then my preferable is every 30 minutes to an hour until the blood is finished, and then at the end another. You're trying to pick up if there's a reaction or a problem. So for sure, vital signs before, then at the 15-minute mark, then every 30 minutes to an hour, and then for sure at the end. You have to be careful with the rate. Usually we start slow because, there's a risk for reaction. So we want to make sure that we can catch a problem and not have infused so much. And also careful consideration for patients that have a high risk of fluid overload. We give it on a pump, at least red blood cells, fresh frozen plasma, and platelets sometimes is given without a pump, okay? And then if you have a complication, then you stop it immediately. We're going to talk about the complications so that way you can see what happens. Here is a look of how the tubing looks. It has 2 spikes, one for saline, one for blood. It goes through the filter and then fitted through the pump and then to the patient. Your blood will have a big label that basically covers all the information of your patient, their date of birth, their type, their RH factor, when it expires, when it was taken out of the refrigerator, and all of that needs to be double checked, scanned into the MAR and all of it, okay? Here's the difference between fresh frozen plasma. It's yellow, but it's light, okay? It's clear, so to speak. And then platelets, they're yellow as well, but it's opaque. It's like cloudy, the color. So you can differentiate, especially if you see them in clinical, that way you can tell which one is which. Now, let's quickly talk about the complications. You can have an allergic reaction. This is usually very common when someone is very sensitive or has allergies. And pretty much it's just the patient being sensitive to the donor's plasma proteins. Um, People get this redness, itching, could be hives, or anaphylactic reaction. And to treat it, you just give them antihistamines like Benadryl, steroids, or worst case scenario, epinephrine for anaphylactic reaction. Now, you can have febrile non-hemolytic reaction, and this is just the antibodies directed basically attacking your blood. So the immune system is just like, whoa, what's going on? This is not mine, it's foreign. And there goes your antibodies, and they go and attack it. So it's common. The patients get fever. Usually it's an increase in temperature by 1 degree Celsius. They get chills, they get headaches. They could get redness of the skin and kind of anxious and body aches from the temperature. For here, you just like stop the transfusion, give them Tylenol and Benadryl. The worst is the hemolytic reaction. This one is severe and it's deadly. It occurs when the person's immune system basically destroys the red blood cell, says, this is not mine. I need to attack it and destroy it. And so, pretty much, this is why we stay with the patients for the first 15 minutes, because the higher risk for this is the first 15 minutes of the patients getting the blood. The patients can complain also of fever, chills, back pain, like flank pain, abdominal pain. They could have blood in their urine, circulatory system collapses. You can have hypertension, tachycardia, cardiac arrest. So this is deadly, and it's the worst of the worst. You treat it by stopping the transfusion, get the blood in a urine sample, maintain the blood pressure with fluids, give them diuretics to maintain the urine output, because it compromises everything and the kidney starts shutting down. So you want to make sure you have an open IV and flush fluids through that. And the fourth adverse reaction or complication that I will mention is fluid overload. So patients with heart problems like congestive heart failure or kidney, you have to be very careful when you give them blood, and because they are high risk of fluid overload. So in the hospital, sometimes when we have these old little ladies or gentlemen, they have like congestive heart failure, what the doctor will order is give them one pack, so like one bag, push Lasix, furosemide, which is a diuretic, so that way they can pee out the extra fluid, then give another bag, and then follow it with more furosemide or diuretic. So basically, yeah, I'm giving you fluid, but I'm going to give you a medication to flush out that fluid. That's clever. First time I saw that as a baby nurse, I was like, whoa, what is this? And then I understood what it was for. So here is a easy to read that I know you guys really enjoy it, for my visual learners. And then kind of steps and key points about blood administration visual as well. Okay, well, I hope this was helpful and a quick review, and I will see you in the next video. Bye-bye.